This is about the benefits of modified citrus pectin in the realm of cancer, of oncology. But it has many other very dramatic benefits, a lot of which were discovered really lately.
What are some of those? Can you touch on some of the other benefits?
Yes, we know that because of the structure of modified citrus pectin, it is a very powerful chelator of heavy metals. And it selectively binds to heavy metals without depleting the essential minerals. And we have demonstrated this in, I think, 3 different clinical trials, showing a dramatic effect in reduction of lead in children with lead poisoning, total body burden of mercury, cadmium, and arsenic without depleting minerals. So it's a very safe, gentle chelating agent. So when you use modified citrus pectin, you will not get the regular side effect of using harsh chelators that are used intravenously. For the chelating purposes, when you combine it with modified alginates, you can get a more powerful effect because the alginates are preventing the reabsorption of the heavy metals. So that's one area that I've already established the research about in the last, I would say, 7, 8 years. I just published a paper about 2 weeks ago with a group from Indiana Medical School and from the USDA. It is based on a discovery and an assumption I had many years ago. They demonstrated that modified citrus pectin is one of the most powerful immune enhancers. We took blood of healthy volunteers and we showed that it increased the level of cytotoxic T cells, the T cells that can fight cancer, by 160%. It activated natural killer cells tenfold, dramatically stronger than interleukin-2. And when we took this natural killer cell that it's activated and we checked if it changed their activity against cancer by testing them against leukemia cells, we had a 50% increase in their activity as well. So it's really, I do a lot of work with medicinal mushroom, and we were surprised the immune-enhancing effects of MCP were stronger than the immune-enhancing effect of medicinal mushrooms. But there is something which is more dramatic about MCP, and it's important philosophically for me, especially from coming from a holistic point of view. It's important for somebody who's a clinician, a healer, but also an inventor and a researcher, not to get too attached to their invention. In my clinic, I use a lot of things. But I have now, especially in the last few months, come to recognize that modified citrus pectin is one of the most important, if not the most important supplement to take. And here is why. The topic of galectin-3 is one of the hottest topics in research now. To give you a sense, Scott, there's a paper published every 36 hours on galectin-3, a peer-review paper.
Okay.
What they are finding out is that galectin-3 is involved in the repair of injury, and in the process, when it gets elevated, it produces chronic inflammation and fibrosis. So almost every chronic disease is associated with elevated galectin-3 activity. Liver cirrhosis, kidney failure, pulmonary hypertension, gastrointestinal illnesses, and very dramatic cardiovascular disease and heart failure. Patients with heart failure, if their galectin-3 levels are higher than the other groups, their mortality rate is 3-4 times greater. More than this, an epidemiological study just published on 8,000 people showed, when they looked at them and they looked at their levels of galectin-3, and they divided into 5 groups of the lowest 20%, 20 to 40, 40 to 60, 60 to 80, 80 to 100. They compared the general mortality, how many people will die, what percentage, in 10 to 12 years, from the lowest levels to the highest levels. And this is in normal population. They found out that while the lowest level, about 4% died, in the highest level, 15% died. So it between tripled and quadrupled the death rate. Now what's amazing about it? An assay was developed for checking circulating galectin-3 levels as a risk factor for progression of heart disease. And soon, with more data, I expect it to be expanded to cover also for cancer risk and for progression of cancer. It is an FDA-approved test covered by all insurances now, including Medicare. So here we have a molecule that causes inflammation, similar to C-reactive protein, but a greater importance. And the only thing that can address it is a natural agent, modified citrus pectin. A paper published this March in a very good journal showed that the modified citrus pectin that I developed was able to reduce and eliminate kidney damage due to artificial kidney injury in a very elegant animal study. And in the same time, it reduced the expression of galectin-3. So for me, it's like dream come true, because I know the benefits of it. A lot of them are my discoveries. I did the research for so many years. Mm-hmm. Now we have an established test that anybody can take, and most laboratories are doing it or will do it shortly, and we have a natural agent. That's why I recommend MCP, modified citrus pectin, for everybody. For the general population with no risk factors, 5 grams a day is enough. And why everybody should take it? Because everybody either has heavy metals, would enjoy supporting their immune system, has different injuries that can cause damage, and as we age, galectin-3 naturally go up. So that's the maintenance. If you have no health problems, but when you do a blood test, your galectin-3 levels are elevated beyond 14, you should take 10 grams a day. And if they are beyond 15, you should take 15 grams a day. Of course, if you have cancer, or you're after treatments, if you have coronary artery disease, cardiovascular disease, hepatitis, any inflammatory illness, or highly elevated galectin-3, you should take the full dosage of 15 grams pretty much for life, because it doesn't remove the galectin-3. It just neutralizes its detrimental effects. Okay.